Have you ever wondered what happens when the human mind starts fighting against itself? Why does one person experience overwhelming fear from everyday situations, while another person struggles to control unwanted thoughts? Why do some people feel trapped inside sadness, lose connection with reality, or experience emotions that feel impossible to control? The human brain is one of the most powerful systems in existence, but like any complex system, it can experience difficulties. Today, we will explore the psychology behind mental disorders, what they are, why they happen, and how they affect the way people think, feel, and experience life. The human mind creates our thoughts, emotions, memories, decisions, and sense of identity. But mental health is not simply about being happy or sad. Everyone experiences stress, fear, anger, and difficult emotions. These are normal parts of being human. A mental disorder is different. It occurs when patterns of thoughts, emotions, or behaviors become so intense or persistent that they create significant difficulty in daily life, relationships, work, or personal well-being. Mental disorders are not signs of weakness. They are complex experiences influenced by many factors, including genetics, brain chemistry, life experiences, environment, stress, and trauma. To understand mental health, we first need to understand how different disorders affect the human mind. Anxiety is one of the most common mental health struggles. Fear is designed to protect us. It activates our survival system when danger appears. But anxiety disorders occur when this alarm system becomes overactive. The brain begins reacting to situations as if danger is present, even when a person is safe. Examples include generalized anxiety disorder. A person may experience constant worrying about everyday situations. Their mind creates endless what-if scenarios. What if something goes wrong? What if I fail? What if I lose control? The brain remains in a state of high alert. Panic disorder. A person may experience sudden waves of intense fear. The body reacts with a racing heartbeat, difficulty breathing, dizziness, and a feeling that something terrible is happening. Social anxiety disorder. This involves extreme fear of being judged or embarrassed. A simple conversation, presentation, or social situation can feel like a dangerous threat. Depression. Depression is more than sadness. Sadness is an emotion that comes and goes. Depression can change the way a person thinks, feels, and experiences the world. A person may lose interest in activities they once enjoyed. They may feel emotionally empty, exhausted, or disconnected. One of the hardest parts of depression is that the mind can create negative beliefs. I am not good enough. Nothing will change. There is no hope. These thoughts can feel completely real, even when they are influenced by the disorder. Depression affects energy, motivation, concentration, sleep, and relationships. It can make even simple tasks feel overwhelming. Obsessive-compulsive disorder, OCD, 16. Many people misunderstand OCD. It is not simply being organized or liking cleanliness. OCD involves unwanted thoughts, images, or urges called obsessions. These thoughts create intense anxiety. To reduce that anxiety, a person may perform repetitive behaviors called compulsions. For example, checking something repeatedly, repeating actions, seeking constant reassurance. The difficult cycle is unwanted thought, anxiety, compulsive action, temporary relief. The cycle returns. The brain becomes trapped in a pattern that feels difficult to escape. Trauma-related disorders. Some experiences can deeply affect the brain's survival systems. Trauma-related disorders can develop after extremely stressful or frightening events. The brain may continue reacting as if danger is still present. A person may experience flashbacks, nightmares, emotional numbness, avoidance of reminders, constant alertness. The mind is trying to protect itself, but the survival response remains activated even after the danger has passed. Bipolar disorder. Bipolar disorder affects mood regulation. People with bipolar disorder may experience periods of extreme emotional highs and lows. During manic episodes, a person may experience increased energy, reduced need for sleep, racing thoughts, impulsive decisions. During depressive episodes, low energy, loss of interest, feelings of hopelessness. The disorder is not simply about mood changes. It involves significant shifts in brain activity and emotional regulation. Eating disorders. Eating disorders are complex mental health conditions involving thoughts, emotions, and behaviors related to food and body image. Examples include anorexia nervosa, bulimia nervosa, binge eating disorder, These disorders are often connected with deeper emotional struggles, including control, self-image, anxiety, and self-worth. The visible behavior is often only one part of a much deeper psychological experience. Psychotic disorders. Psychotic disorders affect how a person experiences reality. A person may experience hallucinations, delusions, difficulty organizing thoughts. One example is schizophrenia. Schizophrenia does not mean having multiple personalities. It is a disorder that can affect perception, thinking, emotions, and behavior. With proper treatment and support, many people with psychotic disorders can manage symptoms and live meaningful lives. Mental disorders rarely have one single cause. They usually develop from a combination of factors. Biology, genetics, and brain processes can influence vulnerability. Life experiences. Childhood experiences, trauma, stress, and major life events can affect mental health. Environment, relationships, social support, lifestyle, and daily stress can influence psychological well-being. Thinking patterns. The way people interpret experiences can also shape emotional responses. The human mind is not separate from life. It is shaped by everything we experience. Understanding mental disorders is the first step toward reducing stigma. Mental health struggles are not a person's entire identity. A diagnosis describes an experience, not a person's value. Improvement can involve many approaches: professional support, therapy, healthy routines, strong relationships, self-awareness, learning emotional regulation skills. The goal is not to create a perfect mind. The goal is to build a healthier relationship with our thoughts and emotions. The human mind is incredibly complex. It can experience fear, pain, confusion, and struggle, but it also has the ability to heal, adapt, and grow. Behind every mental health struggle is a human story, a person trying to understand themselves, a person trying to survive, and a person who deserves understanding, compassion, and support. Because mental health is not just about disorders, it is about understanding what it means to be human.